Welcome to the Compliance Advantage podcast. This is where healthcare executives transform compliance from a burden into a strategic asset that drives both growth and peace of mind. I'm your host, Ronan, founder of Ronan Healthcare Compliance and a healthcare compliance strategist with nearly 30 years of industry experience. I'll help you stay ahead of evolving regulations while building the sustainable, compliant organization that lets you focus on high-level strategy and exceptional patient outcomes. Remember, compliance pays dividends. Invest today.
What are the most common compliance mistakes you see these startups make?
The number one thing I hear all the time is we're too small. We're too small to need a compliance program. No one's looking at us. No one can see us. We don't do enough business. We're just too small to be noticed. Well, that may be true on the bigger scheme of things. Is CMS and the OIG, they do a lot of stuff with utilization so they can see trends and billing, coding, kind of utilization, and that's how they do their audits and investigations. Well, all it takes is one person to be disgruntled within your organization, to say that you're doing something wrong if you are, and become a whistleblower. And now you're not too small to actually have something wrong, because once somebody complains about it, now you're big enough for them to come after you on it. And I've seen it. I've seen people come after them for 100, 200 grand, and they're a very small business and they're a very small physician practice, but somebody out there got disgruntled and made a big deal. So you're never too small to need a compliance program. Second one is waiting until something happens. I see this a lot too. We don't need a compliance program until something happens, and then it's way more expensive to put in a compliance program. You have a big issue that you're dealing with, whether it's a CID, which is a civil investigative demand, or you have these multiple TPEs or UPIC audits that are out there that you keep getting denied, or referrals to the OIG or prepayment reviews. Once you've gotten all of those things, they're really hard to unring that bell, and it costs you so much more to go fix it than it would be to say, let's try to prevent it from happening in the future by having a compliance program up front. So waiting until something happens is really a terrible idea, but it happens a lot. And we talked about this a little bit earlier, in really entrusting the compliance program to someone who doesn't understand compliance, doesn't care about compliance, or takes it to the extreme level. That is a thing that I see all the time. And it's very hard to unring that bell when it comes to assigning someone a compliance role and then all of a sudden taking it away from them. It causes people to go, what happened? Did they know something that was bad with the company and you had to get rid of them, or something of that nature? It becomes a reputational issue. So really you need to assign someone to the compliance program and the functionality who really understands compliance and is able to be that strategic partner so the company can grow.
So you listed 3-ish mistakes there. Are there any other mistakes you can think of?
Yeah, there's a lot of stuff once you actually get a compliance program in place that people don't do because they don't feel like they need to, or they feel, a great example, not documenting things because you'll remember, or we just took care of it. We don't need to reflect on it or go back to it. Every compliance issue will come back around in some way, shape, or form. Someone will ask about it. There'll be ripple effects from it somewhere down the road. You'll need to refer to it. You need to show somebody you fixed it. Whatever. So documentation is key. You're never going to remember. And by the way, as I tell everybody in compliance, the day you win the lottery, you're out, you're going to do something else. Somebody has to be able to come back behind you and figure out what you did and be able to go, yes, we can replicate this, or I fully appreciate and understand it. The next one is ignoring employee concerns. One of the things and the elements of a compliance program is investigation protocols. Compliance department should investigate and research and to conclusion any and all compliance matters that have been raised by an individual, an employee, a company, or whatever, right? So it is one of the basic elements. And to ignore a compliance issue that has come in, or say, that's not a big deal, we're not going to investigate it, or that's not really a compliance issue, I'm not going to go look into it, is the number one mistake that you can do. There's about almost 1,000 whistleblower cases that were filed in 2024. As soon as someone believes that you're not listening to them, or they do have a compliance issue, whether it's coding, billing, Stark, and a kickback, whatever it may be, they will actually go to the federal government and become a whistleblower. It's a very profitable industry out there for lots of people. It's up to 30%, 35% of the recovery that the whistleblower gets. And there's a lot of whistleblower counsel out there too, who are all they do or support whistleblowers. So the idea of not responding to patient complaints or employee complaints or provider complaints just feeds that fire of somebody going, ooh, I'm going to go tell on somebody because you're not doing anything. So responding, making sure that you're actively listening, and fixing those problems before they become major problems is the number one piece that you need to do. And then finally, compliance not being involved in kind of the business strategy or business development is always a common mistake. You have to be able to have compliance sitting beside you. Whether they're saying something or not is irrelevant, but they are sitting there going, I'm listening, I'm hearing, I don't see any red flags, or I do see red flags, or we need to look out for this, or we need to look out for that. That is the number one mistake that a startup will do, is saying, I don't need that advice. I don't need that person in here because they're just going to tell me no. If they're just going to tell you no, then you have the wrong person in there. You need that person who's going to go, let's figure out how to get there in a compliant way, in a legal way, in a regulatory way. And that's a number one mistake, is excluding the compliance functionality from those business development and business strategy discussions.
Billing can get tricky too. Are there any specific mistakes around billing?
When you look back at 2024, there's about $1.7 billion recovered by the OIG and the DOJ for healthcare fraud, waste, and abuse. And a lot of that comes from False Claims Act violations. Settlements with the False Claims Act can be between $1 million or tens of millions of dollars. I've actually seen it up to almost $1 billion one time with a tenant, a discussion that they had. So False Claims Act is a number one kind of priority for a compliance company or a compliance program and a healthcare company. Oftentimes we will go in and we will say, what are your biggest issues from a healthcare company standpoint? That say bills 85, 90% Medicare. And the first thing that they say is HIPAA. And I just go, okay, patient privacy is really important. Get it. How about your False Claims Act? Oh, no, we're compliant because we got coders and billers who are doing everything and they understand it. Okay, great. What are you doing to test it? And they go, oh, we're not testing it. And I go, okay. So False Claims Act billing and coding is really a number one thing that startups and or any healthcare company needs to be focused on. The first mistake is not understanding what it means or how to do the billing and coding. And it's really easy to put a code down on a record, on a CMS 1500, send it to Medicare and have them pay it. It's really hard to make sure that documentation matches the requirements for that CPT code to be able to support that payment that is made to you by the federal government. And that's the hard part. So understanding what it takes to create a CPT code from the documentation that the provider puts on the record of the services that they render to the patient is the most difficult part of it. So not understanding what that revenue cycle piece takes to be able to go from patient to billing company to payer back to me to get reimbursement is the number one mistake that you understand. So you got to understand coding, billing, and the revenue cycle process. Two, if you outsource your compliance or outsource your revenue cycle, a lot of the healthcare companies feel like my billing company is handling compliance. They know what they're doing. Okay. Technically, you probably have a contract with this billing company that has some sort of indemnification to say you are going to make sure you bill and code correctly and appropriately. But at the end of the day, the government follows the money that comes from Medicare, Medicaid, TRICARE, whatever. The OIG DOJ will follow that money, and whoever received that money under that NPI, whether it's the group NPI or a physician, whatever it may be, those are the people that are responsible for compliance. When you've enrolled your services for Medicare or Medicaid, you have made a commitment to the federal government that you will not submit anything that is improper from a coding billing standpoint, inappropriately, whether it's knowingly or unknowingly, for payment and reimbursement. So that means that you have to be looking out for what you're doing. You have to be testing. You have to be understanding. And to say my billing and coding company is making sure that we do it right, well, guess what? They're not the ones receiving the money. You are. You're getting the money. So when they come knocking, they're going to knock on your door and say, I don't care. You can blame your RCM over here. But at the end of the day, the buck stops here. You got the money. You had an obligation. You told us under your enrollment forms and your conditions of enrollment that you will monitor compliance and you will do this right. Show me where you've done that. Well, billing company did it. Doesn't work that way. No, they may indemnify you for doing something wrong, but you're still on the hook because you did it wrong. You didn't have the oversight. So thinking that somebody else is doing my compliance work is a huge mistake.
This episode of the Compliance Advantage podcast is brought to you by Ronan Healthcare Compliance. At Ronan Healthcare Compliance, we believe in transforming healthcare compliance from a checkbox attitude to a strategic advantage. With decades of expertise, our team of consultants provides innovative solutions tailored to your organization's unique needs. We don't just help you meet your standards. We elevate your business, ensuring ethical practices are at the heart of what you do. Whether you're navigating complex regulations or seeking to enhance your compliance strategy, Ronan Healthcare Compliance is your partner in achieving excellence in healthcare compliance. Ronan Healthcare Compliance, redefining compliance, empowering leadership. Visit us at ronanhc.com to learn more. Now, back to the show.
So we talked about consequences and the seriousness of a lot of these things that healthcare startups cannot afford to overlook. Let's flip that and talk about what healthcare startups gain when they do build their compliance programs correctly from the beginning.
It's the compliance advantage. That's what we talk about on the podcast, right? And first and foremost, protecting your profits. As a startup, you really need to make sure that the money that you're earning and you have put out there and the efforts that you're putting out there lawfully to gain that revenue that you're bringing in to pay your providers, to pay your employees, to make a profit, you got to protect that, right? Otherwise, why are you doing it? And so really the advantage that you get is protecting those profits so you don't have to give the money back. You don't have to have fines and penalties to really hurt your margins or hurt your cash flow, whatever it may be. So really protecting those profits is really huge. Secondly, are your better partnerships, right? Preferred partner status. And these preferred partner statuses come in all different kinds of shapes and forms, right? Whether it is I get a better rate because of a payer who knows that I am checking and double checking and ensuring we're not trying to overutilize care provided to a patient or billing higher codes when they're really lower codes. They really start to look at that and go, you are my preferred partner. And then you also look at hospitals or different contracts that you have. People want to do business with people who are ethical and have a compliance program. And finally, employees. Employees want to work, and preferred partner status is, whether you like it or not, as an organization, as a company, your employees consider you as their partner, right? I work for this company. They're either proud of it or they're not proud of it, right? And you want people to be proud of where they work and who they work for. And part of that is being that preferred provider. And if you have a compliance program and you're trusted, then clearly people are going to feel like they are part of something bigger and special. And then lastly is that patient trust equity. Patient trust is really important to be able to start up in healthcare. If you don't have patients, if you're not taking care of patients, if you're not giving good quality care, and patients don't trust you, you're not in business for very long. And number one thing you see in compliance are people will read the headlines, they see them all over the place and go, do I want to go to some place that's defrauding the government? No. You see this in med mal cases as well. The number one thing that doctors get sued on is not for bad care, it's because they were an asshole. And once you have pissed off a patient from that standpoint, I don't care what the kind of care you are, you're going to get sued. It just happens all the time. It's the same thing in compliance, right? If patients don't like you, you're not going to do business. They're going to make complaints. They're going to do something against you that you need to actually repair that trust.
Two more questions.
All right.
What about day-to-day operations?
On a day-to-day operation side, compliance matters can go from being a huge disaster if you didn't have a compliance program in place to just another thing we manage in compliance. And when I talk to a lot of CEOs and a lot of executive compliance committee, and we have pretty big issues that are out there, I'll say, this came up, this is happening. They're like, oh my God, what are we going to do? We're going to handle it because we have the processes in place to be able to handle this. And stuff happens. It just happens all the time, right? We'll deal with it. We'll mitigate it. We'll prevent it from happening in the future. We'll disclose if we need to. We'll refund if we need to. We'll do all those things that we have to do. But when you don't have a compliance program in place, that thing is huge and magnified on a day-to-day operational perspective, because now you have this big disaster that everybody has to shut down and go deal with versus a compliance program that's managing it on a day-to-day basis to make sure they become just matters that you handle. Executives on a day-to-day standpoint get to start running the business. They get to start looking at strategy, they get to start looking at growth. They start looking at ways to do things better and not having to worry about compliance regulations and statutes, because they know that they have a culture of compliance. They know that the compliance program is detecting, preventing, detecting, mitigating things that are happening. They're looking under rocks and things like that to make sure, and they'll let me know as an executive if something is wrong, but now I get to focus on the future. And I had a really great conversation with one of my clients' executives the other day, and all we did was talk about strategy. All we did was talk about growth. All we did was talk about how we can get there from that perspective. And he knew at the end of the day that we got the compliance stuff covered. Let's figure out where you want to go. And I can help to say whether or not you have compliance issues associated with it. That also positions the company for rapid scaling to be able to say, how do we go into these new markets and how do we get this new business? And that's really important on a day-to-day perspective as well.
Last question to wrap up. What's your advice to someone who's thinking about starting a healthcare company today?
Think about compliance as a foundation. Obviously, it doesn't have to be the first thing, but it has to be something very shortly thereafter. It can't be an afterthought, because once it's an afterthought, it costs a lot more and it takes a lot more time to be able to establish and build, because you're not only building the compliance program, you're managing compliance issues that are coming up, right? Building the plane and flying it at the same time. No one really wants to be doing that, right? It's really nice to build the plane, test it, and then fly it. But if you're doing it as an afterthought, it takes a little bit longer, a little bit more cost, a little bit more expense. Find advisors and people who can guide you who know healthcare operations as well as compliance. Without knowing healthcare operations and how it pertains to compliance, you're really doing yourself a disservice. One of the biggest benefits that I got in my career was to be able to become an executive vice president of operations and performance improvement for a company in my middle of my stint as a compliance officer. Did it up front, did that for a while, came back to compliance. And when you do that, you really are able to understand the needs of the business in a compliance manner, and you can speak the language. So find consultants and advisors from that standpoint. Budget appropriately. Put the compliance budget in, commit to it. It's not a one-time expense. Even if you hire advisors and compliance consultants or whatever it may be, put that cost you're spending in your budget and just say, I'm going to use that for my compliance program coming up. But as a matter of fact, just put it, set it, forget it, put that in your compliance budget and go. When you talk about compliance, don't cut corners. There's not a cheap way of doing it. There's an efficient way of doing it, and there's a cost-effective way of doing it, but there's not a cheap way of doing it. If you're going the cheap route, buying policies, put them on your shelf, you don't have a compliance program. Number one thing, don't cut corners, do it right, and you'll actually get that ROI and you'll get that compliance advantage. And then finally, do what you need to do to protect your investment. And I talk about this a lot, of protecting the investment. It's not just money, right? Yes, there are people invested in healthcare companies and owners and private equity groups and venture capitalists, and I get all that. Even some CEOs have vested interest and put their money in, I get it. But everybody who works for an organization has invested something in that organization, whether it's time, money, career, reputation. Protect those people's investment in that company by who they work for and how they work, what goes on their resume. People who have invested their money in there, protect that investment. Compliance will protect that investment for you because they will be preventing, detecting, mitigating things that are coming up and making sure you know what you don't know. So I would just kind of leave it on that standpoint. As a startup, you're doing something, you're investing in something, you're looking at your career. You may want to sell it in the future. You may want to put it on your resume that you started this company and it was wildly successful. But that is an investment that you need to protect, and compliance can do that for you.
This roadmap is so practical, Ross. Thank you so much for breaking it down so clearly for us. I think a lot of founders are going to realize that compliance isn't this mysterious, overwhelming thing. It's actually a very clear set of steps they can take to build a strong foundation.
That's exactly right. And I hope what has come through, it's not about perfection or spending lots of money on a compliance program, because it's really not about that. It's about doing it right. And it's about making the right decisions on a compliance program and thinking about compliance as an advantage and a strategic partner that can help you grow a startup business and protect your investment from that perspective. The healthcare entrepreneur that is thinking about compliance right off the bat are the ones that are going to be wildly successful. And I've seen it happen over and over again. So this roadmap hopefully is a way to understand what you need to do as a startup from a compliance perspective. And again, you don't need to break the bank. You just need to do it right and don't cut corners. So hopefully this roadmap was able to provide that guidance.
Absolutely. If you're building a healthcare startup and this episode was helpful, we'd love to hear from you. And as always, thank you for listening to The Compliance Advantage.
Yes, thanks everyone. Thank you for listening to today's episode of the Compliance Advantage podcast. If you enjoyed it, please rate, review, and share this episode with someone who might benefit from it. Don't forget to visit us at ronanhc.com for more resources and connect with us on social media for the latest updates. And remember, compliance pays dividends. Invest today.